We're just doing the tour now.
Good.
We did it.
Thank you again.
Thank you. Nice meeting you.
Thank you.
Bye-bye now.
Bye,
Have a
thanks.
safe trip out.
And I'm just handing out, this is just, somebody asked about working with schools. We work with kids, we work very closely with the police department actually. We have an officer who's appointed to work with us. He goes out and he does the helmet fitting. And I'm telling you, nothing is more impressive than a child hearing a police officer who's in full bicycle gear with his bicycle with all of its contraptions, wearing his helmet, saying, "I want to see you wearing your helmet when I see you around town."
Everybody's just
Definitely made me want to bike more.
I'm Erin Canese. I'm a graduate student at UMass Dartmouth, and I work in home care.
Hi, I'm Colleen Kenyon. I'm the WIC director.
Linda Medeiros, Health First Clinical Director.
Deirdre Healy, the Ledoux Center for Civic Engagement at UMass Dartmouth.
I'm Julie Kelly. I work with the City of Fall River Mass in Motion.
I'm Mary McCurry. I'm an associate professor at UMass Dartmouth.
In 2004, we applied for and were granted federally qualified health center status. Now, you've been to STAR already today, so you're aware that they're a sub-recipient of ours on this federal award, so that in the eyes of the federal government, we're seen as one. All of our data gets combined together, related to patient demographics and the number of visits and the number of providers, and our funding is allocated among, between the two of us.
I think in August, just a couple months back from the Executive Office of Health and Human Services. The focus is going to be care management. It's going to be complex care management. So we're looking to go into those high-risk patients that we can't quite get to come into the health center for whatever it is, whatever barrier they're facing. Some of them need a family member to come with them, or transportation is an issue. We're trying to outreach to those people and provide the services for them in their home.
One of the things we do is we do performance measures, and we watch for BMIs for the children, and so that's a huge thing that we're working towards, because we do have a high percentage of that. So we do, it's called Fit WIC, so we try to exercise with the children. The state provides us with a lot of activity, the balls and the jump ropes and things like that to get the kids moving. Breastfeeding is a huge promotion that we do. We do hire peer counselors that talk to all our pregnant moms that are interested in breastfeeding, and then continue once they have the baby and so on. We do cooking demos for our participants. When Julie, had the vision of coming over to this new building, we were able to put in a little kitchen for us, so we do a lot of cooking demonstrations with the foods that we provide with the WIC program, and that has been, very successful. So,
One-stop shopping.
Yeah, it is.
A beautiful facility in the middle of one of the most economically challenged neighborhoods in the city. Okay, many people walk here, so this is a terrific opportunity for people to get healthy once they've been sick. But we've been working in the city for the last 12 years anyway on a project to keep people from getting sick in the first place. So we do a lot of work on primary prevention. This project was launched in 2003 in collaboration with then Mayor Lambert. It's continued ever since then, and we have worked to establish goals for the community in various areas that really use a broad definition of health. We talk about public safety, about health education, about things like housing. This approach has earned us if you look on the wall there, the Robert Wood Johnson Culture of Health Award that we received last year. We're one of the first six communities in the country to be recognized by them, and You can learn a lot more. I'm not going to keep flapping about what we've done and what we do, but a lot of it's in the booklet, and what's not in the booklet is in a brief update, so you can get a better idea. But I think to give you a more specific idea of some of the things that we do, I've asked 3 of our partners members, 1 staff person, and 2 people from different agencies that we work with very strongly, to give you a brief idea of some of the things that we're doing. And I'll start with Marcia Picard, who is our school wellness coordinator.
Okay, anybody have any idea what this is? Very good. Does that appear to be a lot of sugar?
Yes.
It is a fair amount of sugar. Actually, it's 53 teaspoons of sugar, so we're talking about okay, any idea what this is? Okay, it's cola. We won't tell what kind it is, but it's cola. All right, do you have any idea how much sugar is in this 2-liter bottle of soda?
Probably 50.
Yeah, just about this amount. It's 53 teaspoons of sugar in that amount of soda. Was when the families come in, and we get upwards of 300, 325 people at these events. We've had principals say that they get no turnouts like that at anything else they do. I know a great deal of it has to do with the promotion, because the word free is at the top, giveaways, etc. And at the end, we give away door prizes and their bags of groceries. They are all healthy groceries. We never mention that they are healthy groceries, because why on earth would you be giving away anything other than healthy groceries? There are 3 components to the Family Fun Night. One is the Community Resource Room, where we get upwards of 21 agencies, including Health First, including WIC, that will come and set up their tables to let people know what it is they provide in the community. There's one station that's a physical fitness workout station, because the average parent does not want to do exercises or sitting on the floor or play basketball or something. We do line dancing, because it doesn't matter if you're on left or right foot, it just matters that you're moving. And it's something that when we do that a portion of the event in the gym, we do not ask for the bleachers to be pulled out, because we don't want anyone sitting down. So we get grandparents and little ones, and it's just all about fun. And then the 3rd station is a nutrition ed station, where we have a dietitian or a nutritionist come in and do a short period that's on the kinds of things that they should be eating, reading the backs of the labels on packages, and that sort of thing. It amounts to 20 minutes at each station, rotate, 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 long enough to get the information, but not long enough to be bored or antsy. And then again, at the end, they go back to the beginning, and we do the drawing for the door prizes. Every family gets 1 door prize ticket when they come in.
Now, as a CD Rec, we're the recreation department. Over the past several years, we've been very fortunate in receiving some funds through the hospitals, through what's called determination of needs monies, to expand and have full-time staff like Masha that deals with the school. We also have an individual that just does community wellness and worksite wellness. And also we have Dr. David Weed as the executive director, who's really kind of pushing this mission forward. So one thing that I'm very focused on is youth and youth violence prevention. A lot of people don't think it's really health when you talk about violence, but if you start looking at everything and you look at all the data, violence prevention is very key, especially in the urban communities. What we've done over the past several years is we've kind of piggybacked off of a lot of different initiatives that we've been doing through partners, and we've received over $500,000 in state and federal monies to do outreach services to the very high risk and to the proven risk. So the ones that have already got caught with guns, weapons, whatever it may be. So we do like the 3-legged stool. And you take one leg out, the stool falls. We look at education. We look at employment skills, job training, and we also look at wellness. So whether it's health or mental health, a lot of the issues when you look at violence prevention is a lot of mental health, and they need a lot of whether it's counseling, substance abuse, different things like that. And so we partner with Health First, with STAR, with many different agencies, and we try to do wraparound services with the school department and trying to figure all that out. One of the biggest things we constantly keep on doing, and Wendy's going to talk a little bit more about it, is piece by piece summits and more prevention awareness for the entire community.
Piece by piece, P-E-A-C-E by P-I-E-C-E. We say we have every piece but the piece we need. And this is our opportunity to bring together about 200 uber high-risk youth for the day. We usually bring in a national recognized speaker. 2 years ago we had Amina Matthews from Ceasefire Chicago. She's a violence interrupter. And they are out in the streets and they are stopping the rhetoric before it becomes violence. Last year we had the foundation movement, two gentlemen that grew up really hard in Dorchester, both gang members, and had moved away from that and are now working with restorative justice. And they spoke a little bit about their new PBS documentary that should be out next month about a family in Boston, the restorative justice process that they've gone through. So when I first came to United Neighbors, I didn't realize that we were a health organization because we had all these things. We had community empowerment, and we had secure and stable families and violence prevention. But as I learned more and we began to look at the World Health Organization definition of health, we recognized that things like transportation, violence prevention, housing, all come under the umbrella of what a healthy community is like. If you show up at the Department of Transitional Housing and you say you have no place to stay, they're required to find you a place to stay. They're required to find you a bed. Very often, it's sitting in the hospital waiting room or sometimes even in the police station, but they cannot turn you out on the streets. So that is a really wonderful thing, but it causes a tremendous problem. We have run out of beds. We have run out of shelter beds. We have run out of Section 8 housing. We have run out of low-income housing. And the state has turned to what I refer to as no-tell motels, and they have made them into homeless shelters. We have 3,500 families in Massachusetts, that's families in Massachusetts, that are now residing in motels. That does not count families that have doubled up, families that are living in their cars, families that are living with relatives, and families that we're not counting because we haven't connected with them. Right here in this area, we have a motel in Swansea with 36 families. We have one in Somerset with 47 families. In Dartmouth, we have the Dartmouth Motor Inn. In New Bedford, there is a couple of motels. The Whaler is one, and there's another one in New Bedford. There's a couple in Wareham. All these motels are in food deserts. They get their food from the Tedeschi's at the gas station across the street, where a loaf of bread costs $6. So how quickly does your SNAP benefits get eaten up when you're doing that? They live up to 6 people in a room. If there are more than 5 children in the family, if there are 2 parents, they will open up 2 rooms. But if there's only 1 parent, they are all in 1 room. Last year we had for 9 months a family that had 8 children and 1 parent and a father. So all 9 of them were in 1 motel room. So it's quite intense. We have no ability to get them transportation. If we can get them here, we can get them care. But how do we get them from Swansea, Somerset, Dartmouth to the appropriate places, which is a really big issue. We certainly have a tremendous issue with food. We can't even get them to the food pantries so that they can pick up healthy food. Thank God Lisa Alves from the WIC program spends a lot of her time at the motel delivering WIC benefits and WIC packages to the families that are there.
We are interested in figuring out ways in which we can engage with and collaborate with our various health-oriented community members. We very much want to see those engagements to bring value to the table for both sides so that it works for us as an academic institution and facilitates our educational goals for our, in the College of Nursing's case, for the nursing students, but there are also other groups of organizations, colleges on the campus who can also benefit from these collaborations. So we need to have it be a university-wide effort. So we'd like our educational goals to be met. You need to have your health-related, community-based health-related goals met. So I think it's very important to talk about value that's bi-directional when we think about these collaborations going forward. We have some specific programs in the nursing college, and some of the representatives of the program directors are here so they can speak more specifically about possible collaborations there. But we would like to figure out how to have these collaborations take place in both an efficient and an effective manner. So we need to talk about what are the barriers to getting the collaborations up and going, and how can we work on those barriers if they exist, and how can we really get down to the granular level, as our chancellor always says, and really get projects identified and projects underway and projects completed, and then the potential and actual outcomes achieved from those collaborations.
Oh, absolutely.
Wendy, I remember for you if you still have that position. Absolutely. Because I had a student just contact me, and I know